Hey fam, this is Kim, just Kim, um, and I'm just bringing you a little bit of information. Wanted to share with you my journey. I am a 44-year-old mom. I started my journey at 42 years old. I was diagnosed um, in February of 2018 with cervical cancer. I had a radical hysterectomy in March of 2018. At the time, my radical hysterectomy was successful. It was, they said it was a success. However, on one of my lymph nodes, there were cancerous cells. They said about 200 cells wasn't a lot. My doctor at the time said, "Hey Kim, I want you to get radiation and chemo." It was a lot going on as far as like my job, some personal things, and also I had to jump through some hoops with my insurance carrier. So after almost a year, I still hadn't had radiation and chemo. Well, when I went back in 2019, um, I went to go get my testing and to see how everything was. And when I went and got my testing complete, I found out that I had a reoccurrence. Basically, my cancer had moved from one side of the body to the next. I don't know what's going on with this hair. But so that being the case, now I am going through radiation and chemo. I have gone through it. Today, I had my second chemo treatment. And so I just wanted to kind of talk to anybody that needs to hear this information. If you're going in for the first time and you're trying to figure out what's going to be next, I want to be able to be a blessing and be able to share some information with you. One thing that they're going to tell you prior to your chemo and prior to your radiation treatment is that you have to stay very, very well hydrated. I have this bottle, which is my friend to the end. It is, and this is not like a promotional, obviously. This bottle is Hydrate, and I feel like it is a cancer patient's best friend, especially if you're going through chemo. Why this is so important? Hydrate is an app too, so you can link it to your phone. I have an iPhone, but you can do it with Android as well. And it tells you how much you've drank the entire day. So when I go into, I'm going to show you really quickly. So when I go into my Hydrate app, you see right there. So that's how much I drank today. Now, that's a little low. You see, my goal is 100. That's a little low for me, but I have been having some issues as far as like my labs. So they want me to kind of slow up on my drinking, not liquor, water. Slow up on my drinking, and I will. They're going to redo my labs, but this allows you to be able to measure how much you're actually drinking because they want to know. Usually they'll say about 64 ounces. So this is like a blessing. I got mine for $50. Every time you drink, pour out, you sit it back on a level surface, it sinks. So it's going to tell you exactly how much you're drinking. So it takes the guesswork out of trying to figure out how much water you drink. I'm just saying. I use it. I find it a blessing. So that's probably one thing that you want to pick up because you want to be able to monitor how much you're drinking. Chemo does make you extremely, extremely tired. I had chemo today, but I think I had chemo mixed with, I had fluid, and then I had chemo and fluid simultaneously, and I think that helped me. Last week, because I actually wanted to upload this video last week, I couldn't. I was sleepy. I was so tired. I could barely drive home. Today, I feel probably about 90%. It could be that it was my first time. But just always remember, just to kind of gauge that, make sure that you take somebody with you the first time you have chemo treatment, because you don't know how you're going to feel, how your body is going to respond. I was extremely sleepy. I had radiation the same day. I fell asleep on a radiation table. I was just so sleepy, so tired. Um, I am having radiation and chemo. So my plan at this point is 6 rounds of chemo and 6 to 7 weeks of radiation. So that's 5 days a week. So right now, it's looking like mid-October that I will be complete with treatment. There are a lot of things. Now, I had a port installed. Um, Ports, I was a little nervous. I didn't want a port because I didn't want another surgery. They do it in an outpatient surgery, but it's easier for you when you go in for treatment because they're not having to fish for veins. If you're like me, I am one of those people. It's extremely hard for me as far as my veins are concerned, and you can't find them. They got to fish for them. It's very easy with your port. It does make you feel a little uncomfortable. I can take my band-aid off now, but where my port is, it sits here. Usually you can, and I'm going to take my band-aid off. So it's still scarred, but the port is here, and that's what they access. But you see it's covered. You can't see it. Now, honestly, I'm just going to be honest. If you all are getting a port placement, do understand that they're going through your jugular vein. So they're here and it goes all the way down. I had no idea. So I'm just trying to spread knowledge so that you do know. I always say that I have a man vein, but I wear big hair. So it probably doesn't matter. But just so that you know, when you're going in, you know ahead of time. That part wasn't as painful. It was just it's uneven, and I'm used to my throat being even. So if I scratch it, it's like, oh, it's a little bit painful. The other thing, when you go in for your first chemo treatment, if you have a port, they're going to give you some cream to use. It's a numbing cream. Somebody may tell you to put it on 30 minutes before. Everybody may give you something different. I would say put a bunch. And when I say a bunch, I'll try to do a video next week when I go for my chemo, just so that y'all can see it. Put a bunch on there and cover it with some plastic. You can get some saran wrap or whatever. Just put a ton. It's crazy, but put a ton, cover it up. And you'll want to do that about an hour before your treatment. When you go into treatment, you can't even feel that they're poking. You don't even know it's happening. It's very, very easy. Now, as far as radiation, there are so many different things when you go in for radiation, but it's so easy and simple, and it's about 15 minutes. So you're done, really 15, 20 minutes at the most. It's like you're in and out. The flip side to that nobody really tells you is that you can't swim. You can't take tub baths. Can't really scrub. You can't, I'm trying to remember what else. You can shower, but you can't put lotion on. I'm a lotion girl. I like to use oils. It's weird to miss only this part. There are markings on your body. They put little plastic stickers. They don't go nowhere. But they're looking for those stickers because they're lining you up in the same place every time you get on the radiation table. So you just have to be mindful of the area. So you're going to clean your area really good, but you're not scrubbing. And because those markings have to be there for them to put you on the radiation table for you to get your radiation treatment. That's so extremely important. So you want to make sure that you are doing everything that they're telling you to do. I know that people talk about diets. I'll be honest with you, my first week I was extremely, extremely nauseous. With that being the case, it was very difficult for me to try to down different foods. If you feel like eating, eat. The other thing is what worked for me, small meals. So instead of heavy meals, small meals. Um, 9 times out of 10, you're going to lose weight because of the nausea and just the amount of intake that you can take. Um, I can't take as much in as I normally would. So I've lost weight, but I have to be very careful. So I've put my friends and family on standby and just like, hey, remind me, hey, did you eat? Because once I get nauseated, I don't feel like eating. But the trick to that, to not get nauseated, is to eat um, 3 or 4 days, like after I said 3 or 4 days, um, every 3 or 4 hours. Try, and that could be a small thing. That could be a banana with peanut butter. That could be crackers and pepperoni. That could be apples, yogurt, something. But make sure that you are eating every 3 to 4 hours if you can. And then also stay hydrated. The biggest thing with chemo, you want to push the chemo through your system. And if you're not drinking enough, like I know my hydrate said 30, but I also had 2 bags of fluid today, and they're 120 fluid ounces. So I had those when I went to chemo. So I'm already feeling really bloated and full because of that. So it's hard for me to get this out. So I'm going to try my best to get at least to 50 before the night is over, which the night is young. So I think I'll be able to do it. But that's just another thing that I just want you all to be mindful of. When you go in for your chemo, they will give you different pre-meds, is what they call them. So just be mindful of that. So when you get your pre-meds will be a steroid, because that's supposed to help the chemo work better. And you will get a nausea medication. The nausea medication is supposed to be one that lasts for about 72 hours. So that one works. Your nausea medication that you get from the doctor will last. You'll have those, and I have to. I don't have it with me because I'm trying to be in my safe place and not be interrupted. But I'll make sure that I let you all know what those 2 medications are that I take. I take one, and if it's not working well, then I take the other one within 30 minutes. But this week has gotten better. I'll see how I'm feeling, and I'll try to vlog on tomorrow about how I'm feeling the day after. Now, like I said, my treatment was a little bit different. I feel different. I did not feel like this the first time, but it could be because it was the first time the chemo was in my system. I am on what they consider a low dose cystatin. So I think it's 75 milligrams of cystatin. And I'm only going once a week. But they are looking at doing fluids with me. And so after I talk to my doctor tomorrow, then I will keep you all updated and let you all know. If y'all have any questions from me, I know that going into this, I was YouTubing and trying to find out. There were some YouTubers that I was looking at from years ago and some that were in other countries. I didn't see anything in the United States. So sometimes it was a little difficult. I do receive my medical treatment in Houston out of the Methodist system, but there are tons of hospitals I know that do a really great job. The Methodist system is where my oncologist, my surgeon oncologist was, and that's just the system that I've been using, and it's wonderful.